This is our client who had a very rigid pelvis, which I think we described it as a block of wood. And today was the treatment day, so we were able to achieve some gain of mobility when I pressed through the right hemipelvis and when I pressed through the left hemipelvis. There's a freer mobility. Going right to left, there's freer mobility. And same thing going left to right. Could you lie on your stomach, please? Pardon me? And you might recall that the sacrum was prominent in relationship to the PSIS, and now you can see that the sacrum is deep to the PSIS. I can see your feet move. I can see the heels bob when I do this, so the force is going through the pelvis into the hip and lower extremity. And here's a forward spring, forward spring. And I'm able to take up the slack now, whereas before I couldn't do that. And there's inferior spring. I see your heels bobbing up and down. And then here's a superior glide spring test. Take up the slack and I can spring it. So we've been able to successfully gain mobility, and one of the secrets is it takes time. So we had you lay on foam for 10 minutes total, and I pushed sacrum into anterior glide, and I did that for 5 minutes. And this is your sacrotuberous ligament. It's now softer. Let's have you lie on your back again, and we'll demonstrate the gain in mobility in the upper cervical spine. I have my thumbs on top of the mastoid process, and I can bounce it and easily get movement. I can lift it above your ear and you side bend freely. I'm on the transverse process of C1, and I can spring it medially and it goes. I can capture your head and lift it up very freely, and capture the head and traction it. I see toes bobbing up and down because the force is translating through your body. So do you want to sit up and tell us how you feel?
I definitely have freer movement when I'm walking. In fact, I think it's been locked so long that some of my muscles are have atrophied or weakened, so it's a little strange walking.
Yeah.
But my shoulders have relaxed and my jaw feels relaxed, and just my pelvis feels freer. And those bands in the back of my my hamstrings down to my calves feel like there's less tension.
And how long has your body been like this?
Over 20 years.
That's a while.
Yeah.
Very good. Well, I look forward to continuing to work with you, and we certainly will teach you things that you can do to maintain these therapeutic gains.
Thanks for miracles, Jerry.
Thanks for letting us film you.